Hi, welcome back. I'm Dr. Lisa Oldson from Northwestern in Chicago, and I'm going to talk to you today about being healthy and losing weight. So let's jump right in. One thing I see from my clients, especially around the new year, is people are looking for what is the new thing that's going to help me finally lose weight and be healthier once and for all. So, what if I told you there is a new thing, maybe not so new, but a really magical thing that can help you lose weight and maintain that weight loss, that can improve your cardiometabolic health, which means your risk of heart attack, your risk of stroke, your risk of metabolic syndrome. It can lower your risk of type 2 diabetes, lower your risk of high cholesterol, and also certain types of cancer. I think you would be raising your hand, as I would be too, to sign up for whatever that magical supplement is. But this is not available at the pharmacy. So you have to get this at the grocery store and you have to create it for yourself. Why? Because it's not a supplement, it is not a pill, it is not a prescription, it is the Mediterranean lifestyle. Okay? Not just the Mediterranean diet, the Mediterranean lifestyle. So let me tell you a little bit more about that. I am going to share my screen with you. And you're going to see a picture here of the Mediterranean diet pyramid. Right at the foundation, you'll see is not food, but actually activity and social connectedness and getting out and getting some fresh air. So you see people here taking walks, dancing, eating a meal with family or friends, playing some sports. This is at the foundation of the Mediterranean lifestyle. We need to get out, get active, and be socially connected. But then the next most important thing you'll see right down here at the base is a plant forward diet. So look at all of these beautiful, abundant plants, tons of vegetables, fruits, lots of extra virgin olive oil. This has been found to be a key component to the Mediterranean diet that will lower the risk of heart attack and stroke. You'll also see things on here like garlic and onions, which are great for your health, and even some things that many of my clients are nervous about including in their diet, like potatoes. Don't be afraid of them. Just roast them with some extra virgin olive oil, maybe some salt, maybe some rosemary or thyme. It's delicious. You just don't need to lump on all the butter and sour cream and that kind of stuff. Try those purple potatoes. They are full of fiber. You'll also notice something else here that some of my clients are a little nervous about, and that is bread. But this is whole grain bread made from real ingredients. This kind of bread cannot sit on the shelf in a grocery store for a month without getting moldy or hard, like most of our breads today. So if it's a real bread made from real ingredients, and by that I mean some sort of whole grain, yeast, water, salt, it's very simple ingredients. That's fine. Have your avocado toast on a piece of whole grain bread. Absolutely. Nuts and seeds are also a big part of this. Next, if we move up the food pyramid, you'll see seafood. So having a little fish here and there is very good for your health. 2 or 3 times a week, you can have some fish. If you're not entirely plant-based, that's great. You can also have shellfish. Less frequently in the Mediterranean lifestyle, they're eating eggs, poultry, cheese, yogurt, milk. And then at the very tippy top, these are the things we have less frequently, like red meat, which we incorporate in the Mediterranean diet only about once a month. Sweets are way at the tippy top, so they're not forbidden. I really don't think anything needs to be forbidden, but this is not an everyday food. Sweets are for a special occasion. You'll notice that water is the primary thing that people drink when they're following a Mediterranean lifestyle, and occasionally a little red wine, but not too frequently because we know red wine and other alcohol can be associated with an increased risk of cancer. So this Mediterranean diet is kind of like that miracle pill that some people are always searching for. It can give you all of those health benefits. So let me just review quickly again what some of those are. So you're going to reduce your risk of Alzheimer's disease by 40% if you're adhering to the Mediterranean lifestyle. Also, people in midlife, 40s, 50s, 60s, who are closely adhering to this Mediterranean lifestyle are about 50% more likely to make it to the age of 70 without any chronic health problems. So, healthy aging is a really important benefit of the Mediterranean lifestyle. We also know that there's an inverse relationship with adhering to the Mediterranean lifestyle and your risk of cancer and dying from cancer. So, as you eat more in line with the Mediterranean diet, your risk of cancer goes down, your risk of dying from cancer. Okay, so closer adherence, eating more and more Mediterranean means less and less cancer. That is worth the effort. I realize this might not be your intuitive way of eating, no problem, but you can start practicing. And after you do it for a while, maybe it takes 2 years, maybe it takes 5 years, but eventually that becomes your routine. And now you've just reduced your risk for Alzheimer's disease, for a heart attack, for stroke, and for certain types of cancer and diabetes. Not to mention that it helps you with weight loss and managing your weight. There's a famous study called the Preventive study that was published in the New England Journal of Medicine many years back. And that showed that if we take people at risk for heart disease and we put them on a Mediterranean diet and supplement that with either extra olive oil or extra nuts, those people had a reduced rate of having heart attacks or strokes. So these are people at really high risk. If heart disease runs in your family, this is good information to have. You can reduce your own risk of heart disease or stroke by adhering to the Mediterranean diet. So, what are you waiting for? Come on, it's time to start practicing that healthy way of eating with lots of vegetables, fruits, nuts, extra virgin olive oil, whole grains, some seafood, drinking lots of water, and most importantly, being really active and being socially connected to the degree that we can do so during the pandemic. So, obviously, that might mean with masks and that might mean outdoors, or maybe it means this way via Zoom. Thank you so much for listening. I wish you the very best of health.